Few people understand the intimate relationship between the act of breathing and the number of white blood cells circulating in the blood. Today, I will tell you why this relationship could identify people with epilepsy who are at risk of dying suddenly and unexpectedly during a seizure.
A major health alert every year in the U.S. devastated by the sudden death.
Star Cameron Boyce led to a nationwide conversation about epilepsy. The actor's family says he was being treated for epilepsy and died from a seizure in his sleep.
Sudep is an acronym. It stands for sudden, unexplained, or unexpected death in epilepsy.
Although most people with epilepsy have a normal life expectancy, many of them die suddenly and unexpectedly during one of their seizures. There is no way to predict which of these people are at risk of dying like this. However, a simple white blood cell count taken immediately after these patients' seizures could help predict their risk of sudden death during a future seizure. This is because under normal breathing conditions, most circulating white blood cells are stuck inside the lungs, as pulmonary blood vessels shrink when the alveoli are filled with air. However, these cells can move freely when blood vessels grow during exhalation, which increases their number in the peripheral blood. This interaction between white blood cells and respiration may explain why people who require mechanical ventilation after seizures have increased numbers of white blood cells in their blood, as some seizures begin with a prolonged exhalation, followed by a breathless, convulsive period. Since epileptic seizures tend to have a recurrent phenomenology, the sudden increase in white blood cells after a seizure could help identify persons at risk of dying suddenly during a future seizure. A white blood cell count could save lives,